Yeah, not very busy this morning, it looks like. How's everyone doing? Is it warm where you are? What is your favorite thing to stay cool with? Tell us in the comments. I need to fix up one of my accounts. Let's see, pregnancy nurse. I don't know if you guys saw it, but I just had a video on intermittent auscultation that I think is really important. So if you guys want to talk about that, we can talk about that. We can talk about defrosting freezers, as that is what I am doing. This I'm like defrosting my freezer, special time. Good morning, Alicia. Good morning. How's everybody doing? My sister is having a baby, her first. So exciting. Have you had a kid yet, Alicia? Good morning, everybody. How's everyone doing? Hopefully you're well. The internet is not working well for me today. But if you guys have pregnancy questions, ask me in the comments. I would love to answer them. Click here to reconnect. Oy vey. Tell me if you just love the technology too. Password. All right, we got lots of questions here. Should I go to L&D for BP 130 over 89? Currently on labetalol, being induced Tuesday. Did your provider give you any leeway on that? Did they mention when you should go in? And is that just like one? Have you taken it again? I mean, that's not crazy high, but I would call usually your doctor will have somebody in the office that you can call and ask. So that's what I would do. Hello, so I'm pregnant. I feel my baby the most active when I'm laying on my left side. Yeah, a lot of people feel that way. It might be that the placenta is on your left side or right side, so that you feel baby more on the other side. How long do you usually take a test when missed period? Usually the tests will test positive on the day that you would have missed your period. My sister to check the baby at the hospital right now. Exciting. Hello, Unicorn Princess. Welcome back. You have news for us. Let's see. I'm 38 weeks pregnant. I'm being induced on Wednesday. And I think yours was about high blood pressure. Yeah. I would call and ask. Alicia, hopefully she doesn't. Let's see. Unicorn Princess had a doctor appointment, found out I'm having twins. Did you think you were having twins? I can't even remember. That's so exciting. Are you excited? Are you scared? I think both things are valid there. Excited and scared comes with a lot of pregnancy things. If you guys have any questions, ask them in the comments. Let's see. So exciting, Unicorn Princess. No, I'm freaking out. This is a pregnancy after my miscarriage. A lot of providers will say that if you have a miscarriage and you want to get pregnant to do it right away. I don't know if you like drop extra eggs then. I don't know. Do they know yet if it's identical or fraternal? Do they see 2 sacs? I don't know how far along you have to be to see all those different things. So how many weeks are you? Do you know? Very exciting. So if we haven't met yet, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm the creator of the online prenatal class for couples, the easy way to get prepared for birth. I'm so excited that you guys are here, and I'm excited to answer some pregnancy questions. Well, my freezer is defrosting. Well, it's defrosted because I live in Arizona. It only takes like an hour. Does anyone else have to defrost their freezer? I feel like I'm alone, but we've had this freezer a long time. It fits well in the spot it's at, so we just do it, but it's not my favorite. So if you have a question, feel free to put it in the comments. I have slight constipation due to pregnancy. I'm 6 days starting my new cycle. I don't know. Do you need help with the constipation? Increase fiber, increase water. Talk to your provider if you think you want to take something more. It's 2 sacks. I go back on the 8th. One measures 6 weeks and one said 5 weeks, 4 days. Interesting. So if they're identical, would they measure the same? I don't even know. Daydream said, I had a miscarriage last year and enjoying trying to get pregnant, but no luck. So the average time to get pregnancy, to become pregnant, is 9 months. So yeah. If you have pain that's different than your usual, then I would call your provider. 29 weeks today, how much movement should I be feeling a day? It really depends. Everybody's very different. So you can never compare your movement with somebody else's movement. You're 29 weeks, so it's a great time to start doing kick counts. What you're going to do for kick counts is sit down, feel for baby to move, see how long it takes for you to get 10 movements. So any movement is counts, but except for hiccups. So hiccups are like that rhythmic kind of like jumping. If you have any questions about that, ask your provider. But you're just seeing how long it takes to get 10 movements for you. Then the next day, it should be around that same period of time, within 5-10 minutes. If the next time it's like double that, then that's a problem, right? So that's how kick counts are done. If you guys have any questions, you can go to my site, The Pregnancy Nurse, under resources, click on free resources, and I have a kick count cheat sheet that shows you how to do them and has some great resources for more questions. Twins is a whole new things for you. Yeah, I bet. Sydney said some of these get not shown. I have no idea why. There, look, I can approve it. Sydney, 31 weeks with big twins, got the shower, saw lights like dozen fireflies, preeclampsia. It could be something else though. But do you have a blood pressure cuff at home? I would recommend everybody have a blood pressure cuff at home. They're not that expensive and can be really helpful in that type of instance. Oh, could the constipation be due to pregnancy? Yes. Lots of people who are pregnant complain of constipation. Baby takes extra water, hormones. Yes. I'm trying to scroll up. How long does induction usually take? First time mom. It really depends on what your cervix is and how you react to the medications. Carla, though, but I recommend I have an induction checklist that you can go with through your provider. It is again under resources, under free resources. You can find it, and it talks about questions to go over with your provider, because if they know stuff about you, like what your cervix feels like, any other past obstetrical history, they can give you a good guess. Nope, 10 movements is not within 2 hours, is not kick counts. That's not the appropriate way to do them. So many providers tell you that. I have no idea why. Unicorn Princess said, I had my daughter all natural, no meds. I'm terrified I'm going to have a C-section. You know what? It may not be the worst thing, but you may be able to have vaginal. You'll just have to see. I just left a video where the doctors were making fun of women's bodies. Is that true? I've never seen that. Yeah. Pimka, I've been experiencing pregnancy symptoms. I had spotting this month, but not a menstrual test negative. So we are probably not pregnant, but maybe take a test in a few more days. 35 weeks, was in the hospital because of high blood pressure. They gave me steroid shots. Will it affect the baby? I was in a conference just this last week where they said it can decrease babies' movements. It does affect the baby. We give the baby steroids to increase surfactant in their lungs, or to make their lungs more, I'm not exactly 100% sure what it does, but to help mature their lungs earlier. And so yes, but it also can make them move a little bit less. But if you have any questions, ask your provider. I wouldn't just like hang around if they were moving less. I'd call your provider. Is contestant pain normal? We're feeling like I have to push. I'm not sure what contestant pain is. She was less active yesterday, but is moving a lot today. Thank goodness. Yeah. So they say 24 to 48 hours, I think, in the class that I went to. So usually it's because steroids do something funky with your blood sugar. People that are diabetic that get the steroid shots, we notice that their sugar goes way up, and we don't really do anything about it because it's short term and we know why it happened. Yeah. So they think that, yeah, it's due to that. Nora said constant pain normal. It shouldn't be. Constant pain in general is not from contractions, though. Contractions will go and come. So if you have any pain that you don't know where it's from or whatever, I would talk with your provider and see if it's normal. You need to, when you talk with your provider, know if you want them to know if it's normal or if you want them to fix it, because those are like two different things. And some providers will be just like, yep, it's normal, and then move on. But if you want them to fix it, sometimes you have to like say, I wish it wasn't that way. I would like it to be gone, so they can help you. Brianna said at my last appointment 2 weeks ago, they said I was anemic. I'm exhausted despite 12 hours plus of sleep a day, taking iron pills as prescribed. Now I'm nauseous too. They said I want to retest me another 2 weeks. I don't want to wait. I want an intervention faster as I'm miserable. 26 weeks. I don't know. That's above my pay grade, Brianna. It depends on how anemic you are. You might just be super tired. Usually they will take faster action if you are heavily anemic, but if you're not, it really is better for your body to make those red blood cells. How can I actually get this baby out of me? You can get a medical induction, talk with your provider. I've had BPs 151s, diabetics here, probably getting induced. I'm 36 weeks on Tuesday. Yeah, probably you got a few things. Olivia, your baby has to make up their mind. They get to decide when they come out. They get to decide so many things in your life now. I do not have any natural induction methods. I do have a booklet on the best ways or going into labor made easy, where I talk about the things that have to decide that it's okay to go into labor that you can get. I go through some of the methods. The only one that really shows any promise is midwife's brew, but it also has been shown to be unsafe. So most people do not recommend that. Yeah. Yeah. So Nora, sometimes you have to say, if you have a pain, sometimes you have to say to your provider, I would like it gone. Say something along the lines of, it's affecting my day-to-day living. I can't do as much as I would like to do. Is there anything I can do? And you have to realize that some pregnancy pains cannot be fixed, but they should, maybe some stretches, maybe going to physical therapy, things like that. 38 weeks, very tired. It sounds crazy, but the only place I can catch my breath is laying in bed. Yeah. The babies start to take up your lung space as they move into they push your diaphragm up a little bit. So sometimes that's the way it is. However, if you are sitting down and you really can't catch your breath, I would mention that to your provider at your next appointment. Make sure that they're listening to your lungs and that there aren't any issues. I failed the 3-hour glucose test. What are some steps I need to start taking before the doctor calls? I would just make sure that every meal includes protein and carbs, and you want to limit the carbs. My people told me less than 40, but I think it varies person to person. So just start looking at the carbs that you're eating and make sure that you're having protein when you have them. So peanut butter and an apple, or nuts and some cheese, or something along those lines. If I'm spotting, should I still take a pregnancy test? My period isn't due till the 26th. Probably that seems a little early. I wouldn't do it yet. With high blood pressure, is it normal for them to plan to induce you at 37 weeks? It depends. Oh my gosh, guys, I don't know what happened to my voice. 33 weeks, baby is rolling more than kicking. Yeah, so any movement counts for kick counts. But their movements will change. Not day to day. They kind of change over time. If you notice a big change, then you want to talk with your provider. Yeah, often laying down is the only way you feel great. Thoughts on castor oil? I'm not a fan of it. I've seen people take it. They have ginormous amounts of stomach pain, ginormous amounts of diarrhea. And if it puts them into labor, they're having diarrhea while they're in labor. And the problem is sometimes baby has poops in the amniotic fluid, which is not good for baby. And the dehydration and all the stress on mom is not great for baby either. So peanut and cheese has been a huge craving. Yeah, that could be one. Do you know anything about fetal pericardial infusion? I do not. It would really depend on what the ultrasound showed. First pregnancy will be 38 weeks. Am I able to opt for voluntary induction? Usually not until 39 weeks. I'm getting induced next week. Any advice for this first time mom about what to expect? I would 100% recommend that you spend a few hours this weekend taking the online prenatal class for couples. It is the easy way to get prepared for birth. It only takes 3 hours. We cover induction, C-sections, epidurals, natural birth. We cover all of the different kinds of birth. People love it. The reviews are great. And it's meant to do with your partner to get them on the same page so that they can be a really good support to you while you're in labor. So I would 100% recommend taking that. Yeah. And it's all in one place. I know some people are like, oh, I don't want to pay for the class, but there really is such a convenience to having all the information you need all in one spot. You do want to wait until you've missed your period date to check, usually. 33 weeks. Hopefully labor is not soon. That's too early. We want baby to stay in until at least 37 weeks. Not great with PCOS. If I missed your question, you can ask it again. We had a bunch here. The fourth kid here, is it normal for the pain to be so severe down there? It's like I'm being ripped apart at 36 weeks. It shouldn't be, Delaney. I would probably recommend seeing if your provider will give you a referral to a good physical therapist, because they might be able to help you. Physical therapy can do a few things. They can talk about stretches to help alleviate the issues. They can talk about things that we call it activities of daily living. So things that you're doing every day and better ways to do them so that you're not hurting it, like getting out of the car, turning over in bed, how you get out of a chair, how you put your pants on, right? They can talk about doing those things in a way that's not going to make it worse. And those are the main things that physical therapy can do. They can also do things like massage. They can actually do adjustments. They can do what's called dry needling. I don't know how that works, but I actually just got cupping done on my shoulder. Was not really shoulder, like behind my shoulder blade was killing me for weeks. And I was like, should I go to a chiropractor? And he was like, no, why don't you try a physical therapist? So I went to these people he recommended. Amazing. I felt so much better and then I diligently did the stretches after, and within a week I was better. It had been like 3 weeks before I went to physical therapy. So I'm a huge fan of physical therapy. Sometimes I forget how helpful the right ones can be, but sometimes you got to play around and find the right ones too. Delaney, I disagree. I was told that a lot, but there are things that physical therapy can do to help. And I don't know why they're so reticent to refer to physical therapy. You might not even need a referral depending on your insurance. Like I was cash pay, so I didn't actually have to go to the physical therapist, but yeah. I'm trying to approve some of these. 38 weeks here, my Braxton Hicks are getting closer and stronger. Should I go to the doctor to check? So Braxton Hicks are contractions that aren't really pushing baby into the cervix. And you can't really tell if they're Braxton Hicks or if they're labor contractions kind of until baby starts to open the cervix and things like that. So yeah. Thoughts on a chiropractor while pregnant? I think they can be helpful. But many of them really overstretch what they're good at, and they think that they're a medical doctor when they are not. So I tend to veer more towards physical therapy, but I do think a chiropractor can be helpful with your pelvis. And I have had patients who baby was breech and the chiropractor was very helpful for them. I think the key is finding one that just stays in their lane of bones and joints, right? That's all we need. We don't need them to like tell me how to adjust my baby. We don't need to tell them like how to go into labor. We just need them to stay with bones and joints. Yeah. Hello, everyone says here. Hi, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm the creator of the online prenatal class for couples, the easy way to get prepared for birth. It's available 24/7. It starts at $89. It's available for you and your partner to do together so that you guys both get involved in it. And it includes everything: induction, C-section, epidurals, natural birth, natural pain management. I just put in a thing on intermittent auscultation if you're having a low risk delivery. So I'm constantly updating it. I would love to see you guys in there. If you have any questions about the class, let me know. I have a cerclage. They want to induce 3 weeks early. I don't know if that's normal or not. Usually with the cerclage, they'll take it out at 37 weeks and then just see what happens. Usually they don't immediately induce you. So I don't know. I wouldn't say that that's the norm, that they take it out and immediately induce you. So it is frustrating, people that have had a cerclage and then have to be induced at 41 weeks. So who knows? I'm 17 weeks tomorrow with baby number 3. Is it normal to not feel baby move? At 17 weeks, it can be. Yeah. Depends on where the baby's placenta is at. It depends on your habitus. It depends on where the baby is at. And so, yeah, it can be frustrating, especially on your third, because you're like, okay, I should be able to feel it, because usually on subsequent babies, you can feel them a little bit more, but that's not always the case. Oh, you had your first baby at 29 weeks. No, I mean, that's not really a reason to induce unless they think that there's something wrong. So make sure they may say that they're scheduling you and you're thinking an induction. Really, it's just to clip the cerclages out. Or cerclage. Some of them, I don't know how they do them. That's above my pay grade, but make sure that you are on the same page, that they're planning to actually induce you into labor at 37 weeks. Yeah. All right. How long after ovulation can you take a pregnancy test? Usually you want to wait until you miss your period, maybe a couple days before you miss your period. And I always recommend to take it in the morning, because that is when the HCG is more highest in your urine. Yeah. Anybody have more questions? I have 9 more minutes till I need to go restock my freezer. Also, does anybody have to defrost their freezer? Is it just because I'm old? How long after ovulation? How can you use Benadryl cream while pregnant? You got to ask your provider. Normally that's pretty safe, but I can't tell anybody to take any medications. Are you using it for like mosquito bites, or are you itchy? If you're itchy, you need to be sure to talk with your provider, because it could be, oh my gosh, I just forgot of that. It can be an issue with your bile ducts. Like, yeah, so talk with your provider if you're itchy for sure. Guys, I just did a whole article on intermittent auscultation, which allows you more movement in labor. So if you guys are interested in that, I have a new post on the Pregnancy Nurse. You can go to the link in my profile, scroll down and read that post. It's not available at all hospitals, but it might be something to talk with your provider if you're hoping to go natural, meaning no epidural, no induction. I will be 13 weeks on Tuesday, and the cramps and sharp pains are driving me nuts. How can I relieve the pain? You can use light heat, not across your belly, so I'm not sure where the cramps and pains are. As your uterus grows, you can have some cramps and pains as it grows. So, and then just try to relax, see if anything's triggering it. Don't do those things. That's all I can really think of. What to do? 38 weeks pregnant and 3 centimeters dilated. That's awfully normal. I would just try and relax. Yeah. Yeah, I mean, there's really nothing you can do. I know everyone's like, what should I do? But it's like something you can't do anything really. I mean, you can try the mile circuit, you can try lunges, you can try curb walking, but a lot of times people confuse being in pain, like jumping on trampolines, doing jumping jacks, with being in labor. Those are 2 very different things. Yeah. Cholestasis generally does have, without the rash, that's the word. Usually cholestasis is on the palms and the bottoms of your feet, so areas that don't tend to like make you itchy. How to dilate more. I have a post on that on my website, but there really isn't all that much you can do beyond, making sure. I've seen a lot of people here on TikTok talking about making sure that you're doing squats and making sure that you're opening up your pelvis as much as you can. Being on the labor ball, doing sexy hip circles on the labor ball, those are all awesome things, but that's about it. I think we need to get out of the mindset that there is something we can do to trigger labor, because I know on social media we see all these people that are like, I can trigger labor, and it's just not the case, which is a real bummer. I get it. I was 12 days over on my last one. I tried all the things, and studies show that the things, raspberry tea, eggplant parm, jumping jacks, like these things don't do anything. The things we have seen show, like, if you've taken dates for a whole month, 6 of them a day for a whole month, you'll have a decreased need to be induced. But it's definitely not just like putting you into labor. And a lot of people were like, oh, raspberry tea. Nope. Studies show it doesn't put you into labor, and it doesn't do anything to like not need to dilate, things like that. So not need to be induced, I should say. For everybody that's joining, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery. And I also ended up having to get induced on my last one. I was 12 days overdue. And my doctor was like, you need to have this baby. So I got induced and I cried about it forever, which was stupid. I should have just gotten some frozen yogurt and been grateful I was still alive. So yeah, things don't work. And we got to stop taking blame for that. And we got to stop thinking there's something we can do, because so much of parenting is that there's not a lot of things you can do to make your baby sleep. Even though people like to sell us that they can make your baby sleep, there's just a lot of times sometimes you can't do anything. I'm 5 weeks and 1 day and it's my first. Any advice? Hello, welcome, Caitlin. First off, obviously follow me. I would just chill out for that first trimester. Take lots of naps, be kind to yourself, and make sure that you're finding a good provider that you like. And if you go to one and you don't love them, then you'd switch. That's my best advice. Do you have any advice on how to conceive? Well, you have sex and then hopefully you get pregnant. For me, on my last one, I think we just weren't having sex often enough. I worked evening shift. He worked day shift. We just didn't see each other very much. So we did every other day, and that seemed to help. She's now 15. Kayla, the rest. Yes, that first. And when you see like how much your body has to do to start a baby, it's a lot. So that's why I was like, either I have cancer or I'm pregnant. These are our two options, because I've never been so tired. In fact, I got in a car wreck, like backing out of my driveway, because I was just so tired. My kids desperately wanted to go swimming. And I was like, okay, I got this. And I didn't got it. I backed into a car. How do you know anything about endometriosis and pregnancy? I know that it can cause some issues with fertility. I don't know too much, and I think it would probably be based off of you and your individual circumstances. Anything to help with baby going head down? I'm 33 weeks. However, I'm carrying twins. They said it. Twins head down is tricky. Seeing a chiropractor, I've had a lot of people have good luck with that. Spinning babies, but the problem is with twins, I just don't know that it's going to work the same way as it would with yeah. They don't try versions with twins, so you may just end up having a C-section, which is a bummer, but also may not be a bummer. Who knows? If you guys want to check out my podcast, my friend Rachel, her baby would not go head down, and I was expecting her to just be so sad about it. And she was like, no, it's great. I love that I can schedule it. I love that I can she loved her C-section. She wants to just do it next time, even if baby's not breech. It's episode 169 of the Pulling Curls podcast. That's my podcast. That's my first brand, is Pulling Curls. Like I'm pulling this curl. Anyway, 169. She loved her C-section. So maybe that'll help you know that C-sections can be super magical too. Is it normal for your doctor to not see you until 10 weeks? This is my second. It's seeming to be the norm, Emily. I should ask again on my Facebook page. If you guys are on Facebook, come join me at the Pregnancy Nurse on Facebook. I ask lots of questions like this and people give their input. But it seems to be, when I asked before, some people weren't even being seen till like 13 weeks. And then I'm like, when do you get your ultrasound? So it's confusing for me. Yeah. 169. It can be a difficult pill to swallow that you need to have a C-section, but sometimes they're just amazing. I have a few podcasts on C-sections that you might find helpful. I didn't get seen until 9 or 10 weeks. Yeah, I think that's the norm lately. A friend was seen at about 12 weeks. Can you take anything for an insomnia while pregnant? Currently 22 weeks. You got to ask your provider about drugs. Sorry, guys. Is it normal to only receive 2 ultrasounds for the whole pregnancy? Yo, mama, that is actually the norm and what the safety people recommend. There isn't a reason for everyone to have more than 2 ultrasounds. They recommend an early one for size and dates, and then they recommend a second one for growth ultrasound or anatomy. So they're making sure that you have all the parts. And then often at that one, you'll find out what gender parts they have. Yeah. Some people get way more than that, but those are people that are having issues. Yeah. I think there's just a lot of babies being born right now. They seem super busy. And I just think a lot of people are leaving OBGYN. It's very expensive to run a practice. I think it's a very rewarding specialty, but if you have your own family, it's tough. It's very tough. And as a nurse, I tried to remember that when they were sometimes jerk faces, because it's tough. So, yeah. All right. if we have more questions, go ahead and ask them. I have 1 minute left. If we haven't met before, please follow me. I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm the creator of the online prenatal class for couples, the easiest way to get prepared for birth, and the first online birth class for hospital births. I cover everything from induction, C-sections, epidurals, natural birth. It's all in one birth class that takes just about 3 hours. And I'd love to see you guys in there. If you have any questions about it, let me know in the comments. Tweak Talk said, my first appointment was $1,700, just blood work and initial ultrasound. Oh my gosh, so expensive. Are you a cash pay patient? Yikes. Stan said, my baby is measuring 2 weeks ahead and my stomach is measuring 2 weeks behind. Interesting. Yeah. 31 weeks tomorrow. You still got a long time, Jada. Come join me in my prenatal class. It'll be a great way to fill your time. Talk with your provider if you're thinking about size and doesn't really match. This is telling me it's time to clean out my freezer or just put the food back in. Oh, you have an update on your stones. Let me know, Chelsea. Tweak Talk, that's with insurance. They bill your insurance $7,000. Oy vey. So expensive. It's insane. It's insane. They're wanting me to do a low dose CT. What do you think? I'm a little over 13 weeks, super nervous. Kidney stones, right? So they couldn't see it on ultrasound. I mean, usually they like MRI or ultrasound better during pregnancy. So I don't know. I don't know if this is your OB med ordering it or your urinary guy, but I would make sure that they're talking, like literally having a phone call if it's not your OB. So I don't know. I don't see a whole lot of CTs during pregnancy. Every once in a while, they're necessary. Oh, it's urology. So you need to loop in, yes, your OB for sure. But of course, it's the weekend. So magical to be in the weekends. Yeah. All right. Thank you guys so much for being here. This was super fun. Let me make sure I don't have any questions over on Facebook. I do not. Thanks for joining me. Please give me a follow. I would love to have you hang with me here on The Pregnancy Nurse. And you can find me on every other social media platform. Facebook is fun. We get a little bit more engagement. You can ask more questions and stuff on there too if you're interested. But otherwise, I hope everybody has a great weekend. We'll talk to you guys later. Bye.